Everyone has been affected by COVID-19. Whether it be a celebrity, a friend, or a family member, everyone knows someone who has died from the virus, showing that it has high mortality. Yet, in the United States and worldwide, the number one cause of death is not COVID-19, but rather cardiovascular or heart disease. For this reason, the Exercise and Environmental Physiology Lab here at UO looked to study one of the modifiable risk factors of cardiovascular disease, hypertension, also referred to as high blood pressure. Exercise therapy is considered the gold standard lifestyle change to lowering high blood pressure, but studies have found that many people do not meet the weekly standards set by the American Heart Association and CDC. This tells us that it is imperative to find new clinical methods to lower high blood pressure, which brings in hot water immersion to our story. Hot water immersion in the form of saunas, hot tubs, and foot baths have been used for health benefits in different cultures for centuries, but it has recently entered the research world as a possible clinical intervention. Studies have shown that hot water immersion elicits similar physiological changes to exercise, such as improving kidney and endothelium function. Under the supervision of Dr. Brendan Kaiser, I compared the efficacy of hot water immersion to exercise therapy on the ambulatory blood pressure of adults with untreated hypertension as a smaller portion to his overall large clinical study. Although we did not find any meaningful statistical significance between and within our interventions over time, our data showed that our interventions did work. On a case-by-case basis, many of our hot water immersion volunteers had clinically significant decreases in their blood pressure, meaning that this intervention made a large enough difference to make a change in a patient's health. This tells us that hot water immersion does have a seat at the table when speaking about methods to lower the blood pressure of adults with untreated hypertension. With more research, we will be able to find the optimal conditions for hot water immersion that will elicit decreases in blood pressure with the mathematical backing of statistical significance. As another American Heart Month passed this past February, we are reminded how vast an issue heart disease is and how important it is to find different interventions to lower the mortality of this disease. It is imperative that research continue to find modalities to fighting cardiovascular disease, and hot water immersion is an exciting prospect to reach that goal. Thank you.